Afternoon, everyone. My name is Kate Nielsen, and I'm the Education Lead for BC Nonprofit Housing Association. I'd like to welcome you to today's webinar, HR Responses to the COVID-19 Crisis, presented by Marsha Goldford, founder and CEO of the Wisdom Group, as well as Kim Darcey and Shane Schoonen, partners and consultants for Darcey Consulting Inc. The webinar is being delivered from various locations on the unceded traditional territories of the Coast Salish people, home of the Musqueam, Squamish, and Tsleil-Waututh nations. We acknowledge that many of you are currently located in the ancestral homelands of Indigenous peoples around the province, each with their own unique traditions and history. At this point, if you're having technical issues accessing the webinar, please visit support.goto.com/webinar. If you're still having issues after that, please email Jackson Friedman at jackson@bcnpha.ca. Before we begin, I'll give you a brief outline of the format. The presentation will take approximately 1 hour. During the session, please feel free to type in your questions by using the chat feature. We'll then address questions at the end of the presentation. We've allotted 30 minutes for questions as well. As this webinar is being recorded, the audience will be muted, which means that you can hear us, but we won't be able to hear you. And again, please type in your questions using the chat feature. You can type in your questions at any time during the webinar, and as I said, we'll address them after the presentation portion is over. All registrants will get an email with a link to the webinar recording within a day or two, and the recording will be posted under BCNPHA's COVID-19 resources page at www.bcnpha.ca. At the end of the session, you'll be asked to complete a very short evaluation survey to rate your experience of the webinar, and we'd appreciate you taking a moment to complete it. Now I'd like to introduce our presenters. So we have 3 presenters this afternoon. Marsha Goldford is a chartered professional in human resources with over 15 years in management of nonprofit housing and residential tenancy programs, and over 20 years as a senior level HR and training practitioner. She's formerly a board member with BC Nonprofit Housing Association and has been facilitating courses and workshops with us for over 18 years. Kim Darcey's career has spanned multiple industries, including extensive work in the employment sector and social services industry, specializing in business, immigration, and recruitment consulting. And Shane Schoonen is a registered nurse and has spent 27 years in healthcare, including management, education, and direct patient care. He was an educator for nursing at BCIT and specializes in education and training for businesses and organizations. So now, without further ado, I will turn the presentation over to Marsha Goldford.
Thank you, Kate. I'm just going to move the slide along, and I'm going to come on video just to say hello to everybody. Hi. I actually brushed my hair and put some makeup on and put something on other than my workout clothes, because that's what I've been in for the last 2 weeks. Probably going forward for the next 2 months, who knows. I think what I'm going to do is just give a bit of an introduction anyway, and then we're going to move forward, and we need to do a couple of polls, and we're very interested to know who's in the room and how you guys are feeling about things. Just want to say up front that we're focusing on the non-unionized workforce. Those of you who are in unionized workforces will have collective agreements that will pretty much guide you in the actions and measures that you need to take to work with your staff and to protect them. Did that work? That's working. Okay, that's good. I know this has been just an absolutely crazy time for everybody. It's like every 2 hours you get new information, and I don't know how it is for you, but I know some of the groups I've been working with feel like they're just flying by the seat of their pants, and it's you know, kind of like more pandemonium than it is pandemic. But it's really unprecedented, as we all know, and if I hear that term one more time, I think I'm going to be, I don't know, it'll be blazoned on my brain. but absolutely everyone's affected. Everybody around the world is affected, which in some ways is reassuring and in some ways not, because we just don't know how long this is going to go on for. As I said before, the situation is very fluid. We're getting new information in all the time, new directives. Hopefully one of these days we'll get some new information about treatment and a cure, or at least a vaccine. That would be great, but we're not there yet. For me, I think some of the most difficult things that we're going to face will be the economic uncertainty and the challenges that individual households and individuals will face going through all of this as their income starts to be affected and the bills are still coming in. Public health, of course, is paramount. It's the one thing that we're all focused on is trying to contain this virus and flatten the curve. So I'm hoping that today's information will be helpful to you. Some of it you will have heard, God knows how many times, but it's sometimes it never hurts to repeat things and to reaffirm what you're doing. For those of you that are still feeling uncertain about how you should be managing the workforce, hopefully today will provide a mountain of information for you. Please, if you have questions, put them in the chat as we go along and we'll entertain questions towards the end. So I think we're good right now, right? Were you taking some polls, Justin? So the first one is, how would you how would you categorize your society's mandate? And you can select all that apply. Hopefully we've captured most of them. I'll give you some time. The other thing I should mention up front is that we are not legal experts, okay? So you may come across an issue in your own workforce that will require some legal advice, and I always encourage people to check with lawyers or with legal before you take any action. It's really important. You don't want to put your organization at risk. Got it? Good. Okay, so we have mostly housing, 85%, homeless services, 31%, mental health and addictions, 34%, and assisted living, focus on seniors, 30%, and then other. So I'd be interested to hear what the others are, but that's a very good mix. One more poll. We're curious to know how you're feeling about where you are today. So how prepared is your society in managing through the COVID-19 pandemic? Unprepared, but able to manage the day-to-day. So far so good, but concerned about what lies ahead. You have a plan, but you're struggling to follow it. You have a plan and it's working well. So please indicate where you think you stand. Okay. All right, so far so good, but concerned about what lies ahead. That would be most of you. Nobody is totally unprepared, that's good. I think, I'm affiliated with a couple of housing organizations, and one that serves the homeless and mental health. And in both cases, the first week was entirely upside down and confusing and difficult. And then the second week, they were better able. I think as time goes on, you figure out as you go along. So I'm hoping that that's why most of you are saying so far so good, but concerned, as you should be. So I'd really love to know who has the plan and it's working well, because we can all learn from you, that's for sure. So just moving along. Can I move this? So you may or may not have seen this slide. CBC has been posting these, has been publishing these. Doesn't cover the Sunday, so this kind of goes back to the 28th. So what this shows basically is the number of COVID cases in British Columbia, the total number of active cases, which looks like it went down slightly, total recoveries, which has got a really nice up curve, and total number of new cases. So, and what we're hearing a lot is that everybody is interested in having that curve flatten out. Just a little bit more information. So location by health authority, which will give you an idea of what the incidence is in your own region. Vancouver Coastal Health, of course, has the most number, and then Fraser Health. So 444 currently. These are probably outdated, but you can get an idea of the scale within your own region. 444 for Vancouver Health, Fraser 291, Interior 77, Vancouver Island 60, and Northern 12. So those numbers probably would have changed, but I think relatively speaking, they're probably going to be the same proportion as we go along. The cases by age in BC, the blue is the percentage that age group makes up of the population. And we have a lot more younger people than we have older people in BC. And then the red are the percentage of cases, actual cases by age. So you can see when you start getting to age 50 and up that there's a higher proportion of the population that is being hit with the virus. This is pretty much where we are on the curve. I pulled this off of the website today. And you can see that, and I don't know if you guys heard Dr. Bonnie Henry speak the other day. She said she was cautiously optimistic, which is good, but that's because she's starting to see a little bit of a downturn in our trajectory. BC is second from the bottom. Alberta is the one at the lowest point, and Ontario still has a trajectory of going up. We do too, but it seems to be evening out a little bit. And you can see that Spain and Italy have been hit really hard. The US isn't in here in total, but Washington State is. I don't see New York yet. So, but if you're watching what is going on, it's pretty scary in some jurisdictions. So one of the things that you probably noticed is that we've heard this whole new set of lingo coming out of the pandemic. The word quarantine was something that we might have understood in one way before, but now in terms of the crisis, it basically means that you're separating out people who are exposed to the disease so that they don't continue to be exposed to others. They may or may not have it. And as we know, the interesting thing about this particular virus is that you can be asymptomatic, in other words, symptom-free, and have it and pass it on to others. That's the real scary part of it. Self-isolation is where sick people with the contagious disease actually separate themselves out. So this is probably where you have staff appearing with symptoms and you're asking them to go home and self-isolate. People who are returning from overseas or were returning from overseas were asked to self-isolate for 14 days. So that's a kind of a new concept, or not new, but it's certainly an emerging concept in this particular pandemic. Social distancing. Social distancing means we're making changes in our routines that allows us to minimize our contact with others. And the advice we've been given is to stay 2 meters or 6 feet apart from others to the best of our ability. Asymptomatic transmission is what I spoke about earlier. You don't have symptoms, but you're still capable of transmitting the disease to others. Flattening the curve, pretty much had a little picture of that before. What we're trying to do is reduce the number of the incidence of the disease and increase the number of resolved cases over time, so that we're not seeing the virus pass from person to person as quickly. And the real serious thing about having a trajectory that goes up and up and up is, as we all know, the fact that our healthcare system is overburdened and will be overwhelmed soon with the increase of people who are very seriously ill. A pandemic, the World Health Organization declared COVID-19 a pandemic in early March, as you all know. The pandemic means it's an outbreak of a disease that crosses countries, crosses boundaries, and there isn't necessarily a specific number or a threshold number, but it is global in nature. And contact tracing is basically where we want to be. Officials want to be able to understand where somebody specifically was infected, who infected them, where it started, and be able to trace it through. If they're able to do that, then they're pretty much able to contain the infection as we go forward and reduce the number that might ultimately become sick. So what's really important for our sector is that we, as service providers, are considered to be essential services. If you think of it in terms of a labor strike, when that happens, you have to identify the essential services that actually have to continue and continue to provide them. This is similar, but on a much larger scale. So the government has actually, while it has ordered certain businesses to close, it has also identified others that will remain open and continue to provide services. And the services that have been identified by the government are businesses and nonprofits that provide food, shelter, social and support services, and other necessities of life for economically disadvantaged or otherwise vulnerable individuals. And we have a link that you can go to that actually shows the full list, but it includes things like obviously housing providers, food banks, community kitchens, voluntary and community service providers, residential health facilities, mental health, substance abuse and addiction services, transitional social and supportive housing, SROs, and community services and outreach for immigrants, refugees, vulnerable populations, non-market housing, which would include, and I think apply to all of us on the call today. So, I'm trying to advance the slide, guys. I can start talking, but I can't advance the slide. But it's over to Kim and Shane.
Thanks, Marsha. Good afternoon, everybody. We wanted to, well, we'll get that slide up soon, hopefully. We want to look at the pandemic plan itself. I'll just give you a quick overview about what is a pandemic plan and the 3 stages of the pandemic plan. Now we can go to the next slide. There we go. So what it is and what the 3 stages are. So a pandemic plan, it can be part of a business continuity plan. And basically it lays out the steps and the contingencies that will enable your organization to continue to operate during the pandemic. And it consists of 3 stages. So the first stage of a pandemic plan would be the pre-pandemic stage. The pre-pandemic stage would focus efforts on education, service continuity, and infection control. The second stage would be the pandemic stage, where we're at now, where our health officer, Dr. Bonnie Henry in this case, who perhaps some of you are very familiar with her by now, declares a pandemic. So now is the time to activate your plan, and from the sound of the polls that you're all in the middle of your plans. During this stage, the goals are basically to minimize the rate of illness within your organization and to minimize the service disruptions. So we'll get back into this in detail in just a minute. I'm going to mention the post-pandemic stage, and
basically, the post-pandemic stage will begin when the provincial health officer declares that the pandemic is over. And the focus then will be to restore normal services, deactivate the pandemic response, and also to use lessons that you've learned for future planning activities. So whatever is going on for you right now, it's really essential to take note of the things that are working, take note of the things maybe that aren't. And these are things to reflect upon when we get to this stage. Now, if you don't currently have a plan, it's not too late. And I encourage you, all of you, to consider putting a plan together if you don't have a plan. And if you do have a plan, perhaps modify or adapt the plan that you have at this time. So I'm just going to hand over to Shane, and he's going to talk about prevention.
So next slide, please. Good afternoon, everybody. So I'd like to talk about the pandemic stage. That's the stage we're currently in, as if nobody's noticed at this point.
Sorry, Shane, I can't advance the slide. Can you guys do it from somebody else?
Pardon me?
I can't advance the slide, so I need help here.
Oh, hang on.
Okay, got it. Sorry.
Okay, so if you have you been following along from the beginning, the initial priority was to contain this virus. They were tracking travelers, identifying contacts with people, and monitoring people and isolating people as they came up. And that continued on until we started to have community transfer of this virus. And that's where we're at now. And so the focus now is on prevention and breaking the chain of transmission. So COVID-19, as many of you know, is transmitted via droplet, but it also can be airborne, such as with a sneeze or a cough. It can be transmitted through direct contact with the infected individual or surfaces that have been contaminated with the virus. So everybody hopefully has heard this. The steps in breaking the chain are very straightforward. Hand washing, social distancing, sneeze and cough etiquette. And you're going to hear that several times over. So how does this apply to the different organizations? Well, there's a broad number of different organizations on the line today, but the most important thing is that you have clear roles and responsibilities of leadership, staff, volunteers, and contractors. It's important for that organization to have a clear chain of communication. So, and the next part of that communication is in education for the staff in breaking the chain. So reiterating hand washing, social distancing, cough and sneeze etiquette. In addition to that, again, depending on your unique circumstances, is enhanced cleaning, and then also procedures for self-screening for your staff and for screening your clients as well. So you need to consider any procedures that you may put in place, such as the use of personal protective equipment, the use of thermometers. Staff need to understand how to utilize those pieces of equipment appropriately and in the appropriate circumstance. So facilities management, so things where you may have a food service or a communal area, understanding when you need to close those areas. And as our health officer has indicated, the gathering of more than a few people now is not permitted. So so you need to be looking at your what services you're providing. If you're providing food, you may have to modify that so you're giving individual meals as opposed to a cafeteria style. And then you also need to look at your resources and the distribution of your resources. What kind of supplies do you need? Many have found that it's been difficult to get personal protective equipment, things like that. So, working together to try to find solutions to those really challenging questions. Next slide. Marsha, next slide if you can.
I got it.
Oh, yep, there we go. Sorry,
I'm ahead of you.
You're ahead of me. So contingency planning. So it really is important to identify things within your organization that you need to focus on. So workplace hazards. So during a pandemic, depending on your organization, there may be additional workplace hazards. In this situation, an invisible virus. So the focus again will be on eliminating or mitigating staff exposure. So I'm going to go back to education on protocols if applicable. So recognizing the signs and symptoms of the virus, so a fever, cough, shortness of breath, that might be with your staff or with a client. The use of personal protective equipment. It's not simply throwing on a mask and gloves. You need to know the proper order to put them on and to remove them as well. When to use a face shield, if that's, depending on what your situation is, if that's something that you need to be doing. And then other equipment, if you're utilizing thermometers to screen people, do the staff understand clearly what the results of that is? How to interpret the numbers that they're seeing on a thermometer, for instance. So again, you'll hear this over and over again. Hand washing, social distancing, cough and sneeze etiquette, and enhanced cleaning. So I'll give it back to Kim now.
Yeah, and we're looking at service interruptions. And I know Marsha just pointed out a little earlier about what's important to your organization in terms of essential services. Identifying these essential services will allow you to pivot and focus on the delivery of your core services. So you should have established what those essential services are. In terms of staff shortages, it's likely, if not already, that you've seen an increase in staff absences. If you're able or have been able to, cross-train your staff and facilitate redeployment if necessary. And I know, again, Marsha mentioned if your organization is under a collective agreement, then it's really important to understand the language around emergency situations. In terms of supply shortages, and we just pointed on that also, that it goes without saying that you will need adequate supplies. And as we've seen within a pandemic, it's not easy to procure these supplies. There will be a need for flexibility, creativity, and which will definitely be the words of the day for sure. In terms of communication plans, again, it's really, really important to establish early on the clear lines of communication. And this can be in a number of ways, certainly email, posters, daily teleconferences with staff, but certainly something consistent and clear. And the real important part about the communication is that this will give your team assurance and support. Everybody is going, all of us are going through this, but those on the front line certainly more so. It also allows, with clear communication, to dispel rumors and provide factual information, making sure that people are clear, that the communication is transparent. So you will have an opportunity to ask more questions at the end of the presentation, and so I will hand back to Marsha.
Thank you, Kim, and thank you, Shane. So I'm going to talk a bit about some of the human rights and legal considerations, and I just want to remind you again, I am not a lawyer and was not trained as a lawyer. However, I have been listening to a few of the legal experts on this subject through a number of webinars lately and doing my research. So hopefully the information I'm imparting to you will sound reasonable, but again, I'm going to ask you, if you're taking any kind of serious action with regard to an individual, you want to seek legal advice before you do so. You don't want to put your organization at risk. Some of the overriding themes of the legal experts who were speaking on these webinars were things like showing compassion at a time like this towards individuals. There may be people in your organization who are consistently poor performers or demonstrating bad behavior. This is not a time to be necessarily trying to impose progressive discipline on them unless there's a very serious issue. You want to show compassion to the extent possible, show trust in your staff, and invite them to trust you in return. Err on the side of caution, and consider the implication of your actions and how difficult. For example, you really, if you're thinking about letting somebody go at this point of time, you really think about what kind of impact that's going to be on their ability to mitigate their losses, given the way the economy is right now. So this is an unusual, unprecedented time that we're living in. So in terms of human rights, the two things we always remember is you should not be practicing discrimination of any kind during this process, during this time. And that would apply to people that claim to be ill or claim to be looking after somebody who's ill. While BC has not yet declared COVID-19 to be a disability, Ontario has, and it may be that BC is soon to follow. So keep in mind that if somebody has a family member who has the infection or they themselves think they have it, you cannot discriminate against them on the basis of their having the infection. And the other thing with the human rights legislation that you need to consider is you need to accommodate their needs. So if somebody shows up showing symptoms, or if somebody returns from a trip and they didn't self-isolate for the 14 days, you want to send them home. You can do that. That's the requirement, basically, and you're doing it as a means of protecting your workers, your workforce, and people that you're supporting. So it's important, though, to know that you should not send anybody home unless your concerns are reasonable and consistent with public health guidance. So I think, again, err on the side of compassion. If somebody's not feeling well, or they show up not feeling well, or they've got someone at home they're concerned about, send them home. Let them deal with that at home. I'm going to talk a bit about the employment standards legislation. There's been recent changes to that. Also, WorkSafe BC's occupational health and safety legislation, and just case law in the sense of what case law, how it would have been applied in normal circumstances and how it may be changing going forward. So in terms of the changes to the Employment Standards Act, the province has made changes to the act to better support workers during the pandemic. So the changes basically allow workers to immediately take unpaid job protected leave if they are unable to work for reasons related to COVID-19. So this means that you may have workers who are ill that need to self-isolate. You might have workers who need to care for a child or another dependent, could be an older dependent or partner, or whose employer, or concerned that they may expose themselves to others. So if there's a risk, if you sense a risk at all that that person might be putting others in jeopardy in the workforce, or your clients, other people they come in contact with, then they need to take a leave without thinking that they're going to be let go as a result of it. So in other words, their jobs are protected. They don't require a medical note. And you should note this, employers should not really be giving notice of termination while you can't give notice of termination while someone is on a protected leave. So this just basically ensures that people don't lose their jobs, and while we're all prioritizing everybody's health and safety. So I'm going to go over this later, but what's really important to know that is if you send somebody home, there are programs, there is financial support through a number of expanded employment programs, insurance programs, and other kinds of grants that the government has announced. So they're not necessarily going to be out in the cold. So if while somebody's on leave, their employment is considered continuous. So that means that any wage or benefit increases that come about as a result during that time, they would be entitled to those. If they continue, if they pay a premium towards their benefit plans, as does the employer, they can continue to make these payments and continue to be on benefits. So you want to keep that in mind. If any of you pay 100% premium, you want to be able to continue those for the employees as well. Not necessarily all of them. You can just basically maintain the extended health and dental, so the ones that would be most important for them at the time. So the leave is indefinite because we really don't know if a person truly is infected, and if they are infected, how long the infection will last, and when they are going to be free and clear. Until they've actually been tested, and we know for sure. And I think it's like 2 tests within a 24-hour period. We know for sure that they are no longer they no longer have the infection. So all of these rules are retroactive to January 27th, which is when BC had its first case. Okay. And again, no medical note is required at this point in time. They don't want people going to the doctor's offices or to medical clinics, and most of which are closed and probably doing their business via phone or online. But they just don't want people having to show up at these places and with the risk of infecting others. WorkSafe BC. So occupational health and safety legislation still applies. If somebody were to access the benefits or the program at this stage, the reason it would be because they became infected at work, doing something while they were working on the job. So it must always be work related. So there are a number of employees, of course, who are exempt from this, and those would be people who provide healthcare services, who would normally be exposed to risk on a regular basis. So first responders, maybe some of your staff might be in that category. I don't know, but it's certainly worth checking out. You have a legal duty to take all the reasonable care to ensure the health and safety of workers. So that was the kind of thing that Shane and Kim were talking about. Keeping people informed of what they need to do to be free of infection, keeping the workforce, ensuring social distancing, and maintaining sanitary standards, cleaning multi-touch surfaces. So things like that, make sure that you are doing those, because if they're not being done and a worker perceives that they are being exposed to the virus, they would consider that to be unsafe, and they could legitimately refuse the work. If somebody refuses to do work, you would do the same thing as you do normally, except you would remove, in this case, you would be removing them or stopping them from having to do what they need to do in the location they're doing it, in the way that they're doing it. So you need to think about accommodating them until you actually can investigate the situation, determine if there's a legitimate reason for that work refusal. And if there is, then you want to be able to accommodate that worker. If there isn't, then they really should go back to work. You want to always ensure and take extra measures to protect vulnerable workers in the workplace. So those would be people who are at higher risk of contracting the infection. Those would be people over the age of 65 or over the age of 50 in some cases, people who have a compromised immune system, people who have an underlying health condition, medical condition, which makes them more susceptible to the infection. So I've just listed 2 websites. One is WorkSafe BC's updates, which is refreshed frequently and provides the information that you need to know to be able to continue to comply with the legislation. And then the WorkSafe prevention line, which just gives you some more information, gives you access to things that you can do to make sure that your workplace is safe. In terms of case law, there's we really haven't had any case law at this stage, but there is some sense by legal experts that during this period, what would traditionally be hard and fast rules that might be applied in specific situations may be loosened up a bit. So the notion of constructive dismissal, for example, where you might have to take action to reduce somebody's pay or reduce somebody's hours of necessity to protect them and to protect other workers, that would ordinarily be considered constructive dismissal in most cases. However, because you're doing it for public health reasons, it likely will not apply here. But one thing that the legal experts all agree on is that if you're going to do anything like that, get the agreement in writing of the employee. So I know that sounds strange. Somebody's not going to voluntarily reduce their pay or reduce their hours, but in this situation, there may not be a choice. They may willingly want to do it because, again, they have others at home that they need to protect. Or in the case of people, of parents of young children or any children, school-age children, who are not able to go to school because schools are closed, they may be more than willing to reduce their hours to be able to be at home and look after their kids. So it's a whole new world out there in terms of constructive dismissal of what your employees may or may not be willing to do. So if you can get written agreement from the employee in advance to do what you need to do to protect the organization, and this is very important for businesses, those that are declared essential services, because they may not be able to stay in business unless they reduce their payroll. So these are just considerations that are going to become more clear as we move past this particular stage in the pandemic. I wish we could have like a to and fro, because it would be really good to know who out there has faced these kinds of issues. So maybe you can put that in the chat. Maybe some of your questions. Let me know if you've had to reduce pay or you've had to reduce hours or benefits for that matter. So here are some measures that you can take. And it was interesting because when I was thinking about this subject, I was thinking, well, you know what, we're nonprofits, so we're continuing to be funded. And we're considered to be essential services, so we really have to continue to keep the doors open and be in business. So why would a nonprofit need to reduce their payroll unless you were losing your funding? And that may be the case for some of you. But aside from that, you're more than likely facing a situation where you have fewer staff coming in because they may be symptomatic or they've got somebody at home they're taking care of, whatever the reason be. So you're having to make adjustments to schedules, having to change the way people do their work. You may be reducing the hours that they're working. You may be offering more flexible shifts for people, because if people have to commute in on transit, then you want to, you could use this as a means of being able to allow them to come to work at times when it's not peak transit periods. So there are all kinds of things. We all have paid leave entitlements. Those would be things like vacation and sick leave. One thing, and I'm not sure you want to do this, but in some cases you can do a paid administrative leave. Normally, paid administrative leave would be used for disciplinary reasons when you're trying to investigate somebody and you don't know what the outcome of the investigation will be. But you can use paid administrative leave for an emergency situation, and certainly the current pandemic is considered an emergency. That means that you're just basically telling somebody to stay home, not work, and you're going to pay them. There are all kinds of EI supported leaves of absence, which I'm going to talk about next, and you can use temporary layoffs. So temporary layoffs, in fact, if you're going to lay someone off, it should be done on a temporary basis. The reason for that is that A, you don't need to provide notice, you don't need to provide severance. You're laying them off for up to 13 weeks. At the end of that 13 weeks, you would be bringing them back. You can extend, and you can get their agreement again in writing to extend beyond that. And so the government allows you to do that. And so people who need to be off and no longer have their leave entitlement. And again, you can use vacation too, but one word of caution, if somebody wants to use their vacation so they're getting full pay for the time off, get it in writing that they're allowing you to do that. You don't want them coming back afterwards and saying, I never agreed to that, blah, 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 blah. So if you have any questions about that, put them in the chat. So I want to talk a bit about what the government is offering employees who are not able to come to work during this period. And I should say remote, to the best of your ability, you want to be able to allow people to work from home if you have that capability. And if you do, you want to make sure that they're equipped, that the connection is secure, that they still maintain a safe workplace, even though it's at home. The rules still apply. So that is always an option for those who do office work, the administration area of your business, or there may be some workers who work at a desk and can work at home. So the federal government has this, and this could be it probably is already old, but they have what's called the COVID-19 Emergency Response Plan. It's offering actually beyond $27 billion to support workers and businesses, so both workers and employers, and $55 billion in tax deferrals. The government has what's called a work sharing program. What that is employees agree to work fewer hours. Let's say they agree to work 3 days instead of 5, and the government will top up their wages for up to a period of 18 months so that they're still whole. So your people don't work full time. This is a means for you to be able to reduce your payroll. It still means that they have to do their work during that reduced period of time, okay? They also have, and I've also put a link, if you could put the link on the side to the, I have it at the end, work sharing program, and you guys can take a look at that. That's always available, but I think it's being doubled in terms of the length of time that somebody can take. Can continue their work sharing program. So it's always been available, and it's a federal government program, but you can take advantage of it now, and it can go beyond what it used to be. And you probably know about the Canada Emergency Response Benefit, which is $2,000, and it's available on a monthly basis for up to 4 months. It's available to employees whose income is reduced due to COVID-19, and it includes non-EI eligible workers as well as EI eligible. So it includes those workers. Those would be independent contractors, workers who are home caring for sick family members, or children that are unable to attend school or daycare. Any employees who suffer reduced earnings but are not on full layoff, if they qualify, and as well as EI qualified laid off workers. They all can receive this $2,000 per month. Then there's something called the EI subplan, which I didn't know existed before, but employees agree to a reduced work week, and the employer can offer a top up. Sorry, EI tops up to a maximum of $54,500, $54,500, just $54,500 per year. Sorry. So if an employee agrees to work reduced hours, please ensure that they know what the impact of those reduced hours will be on their entitlements, so their leave benefits. So if somebody's on leave they do not accrue vacation and they do not accrue sick leave. They need to understand how that's going to impact them. And so there's a number of other benefits. There's the enhanced child benefit. I put the links to these programs at the end of the presentation. So you can go in and take a look, but you can see that what they've done is they've extended tax filing deadlines, I believe, to September. There's a new Indigenous Community Support Fund. They've enhanced the Reaching Home initiative. There's increased support for women's shelters and sexual assault centers, and reduced minimum RSP withdrawals for people who are forced to have RIFs and are forced to withdraw RSPs, people who are 71 and older, in other words. And there's a moratorium on the repayment of Canada student loans for a period of time. And Kim alerted me that there was this just in, and as I say, things are changing by the minute, right? So the government will also provide up to $50 million to women's shelters and sexual assault centers, including facilities in Indigenous communities. And this is to help their capacity to manage or prevent an outbreak. They're providing counseling services to children and youth. So, sorry, providing support for counseling services to children and youth. And that would be in the way of $7.5 million in funding for Kids Help Phone. That's available to young people. So young people that are facing mental health concerns and that they're experiencing during this tough time. And then they are providing immediate essential services to Canadian seniors, those being things like delivery of, so any services that provide delivery of groceries, medications, or other needed items, or personal outreach to assess individuals' needs and connect them to community support. So that was just announced yesterday. It seems that day by day there's something new, so keep your ears open and follow the websites. It's probably the easiest thing to do. BC has committed $5 billion, 2.8 of which is on people and services, 2.2 is on the business economic recovery. So those would be keeping your employees whole to the extent possible and allowing you guys to continue to be able to function during this time. And it includes both direct payments to individuals and households and deferrals as well. So the emergency benefit for the province is a one-time $1,000 payment to workers who are affected, who have lost income because of COVID. And of course, BC residents can also obtain federal health and so federal employment insurance and the Canada emergency response benefit. That's $2,000. For you guys, they're for everybody, every employer in the province, they're deferring the payment of the employer health tax, so that does not need to be paid. Deferral of student loans that may or may not affect your folks. And then BC Housing, as you probably know, is providing funding for housing supports. They're increasing the funding for housing supports so that you can maintain housing, and they're doing it for and they're ensuring that there's not going to be any evictions during this time. So evictions would be in subsidized and affordable housing. And ICBC is allowing people to defer their monthly payments for up to 90 days. I don't know if your staff are aware of that. BC transit fares and passes are not required during this time. And TransLink fares and passes are not required as well for anybody who lives in the Lower Mainland. And BC Hydro customers can defer their payments or access grants to help with their bills. So there's a lot of different ways that people are being supported. But one of the most important things for us is that the government has assured us that they will continue to provide funding to nonprofit agencies and childcare providers, even if you're closed or have had to reduce your hours of operations. That's very important to keep in mind. So some pandemic best practices. But a little bit of time before we can entertain questions. Kim and Shane talked about having a pandemic plan. So even if you didn't have a plan, and it's probably unlikely that you did, I would suggest, when you started out, you're probably taking actions and putting in measures during this period of time that are working and some that aren't. So keep a list, keep a running tab of what is working, and make sure that you record it. It will help you put together your plan and have it in place if and when the next time happens. I'm just going to mention HR Insider, which is a partner of it's a partner business of the Wisdom Group. They have a package that they're offering nonprofits at this point in time that includes their HR Insider website, their OHS website, which is about workplace health and safety, and their Safety Now newsletter. And they're willing, and it's normally around a $2,000 value, and they're offering it for about $500. And that's a really good resource for anybody that doesn't have internal HR resources. So if you don't have an HR person that can do this stuff for you, they have experts that help. They have policies, they have all kinds of things. So I'm just putting a plug in for them, because the one thing that they've done as well is they have a webinar that you will be able to access. I'm going to put that webinar on the Wisdom Group website, and you're able to access it and view it. And it's the one that features the legal perspective on the pandemic. Just a few policies that you would benefit from having in place. Again, HR Insider has all of these policies. They have, all you need to do is download them and customize them for your own workplace. And there are other places you can get them if you have HR downloads, or you can always seek our advice. So there are a number of these that are particularly important during a pandemic. Emergency and service interruptions, working from home, work refusal policies, really important to keep in mind. PPE, infectious disease control. In this case, respiratory protection is important to have something on that. And yeah, I would, return to work is going to be an interesting element of this whole thing. At the end of the day, we want to make sure that people are returning to the workplace virus-free, infection-free. And it'll be interesting to see how we turn the lights on again after all is said and done. Anyway, just at the beginning, they were talking about having two COVID-19 tests within a 24-hour period that were both negative. So if you had that, then you were able to return to work. But there's too many unknowns at this point in time, and I think they don't want to exhaust the number of tests that they have available to other people. So at this point in time, it doesn't look like that's a requirement, but you want to make sure you take extra steps to ensure that people are safe and able to come back to the workplace. So there's a number of checklists and forms and notices. Many of these are available. I'm just going to speak quickly to the self-assessment tool, which is on the BC and the federal government worksite, but there's a BC self-assessment tool that is about the symptoms. Your staff can be checking these on a regular basis. If they answer if they answer negatively to all of the questions, then they're probably clear. It could be asymptomatic, but it's likely that they're clear of the disease. So that's something that people can use. And then there are all kinds of memos, and there are all kinds of templates for memos and screening forms and things like that that you can use and customize to your own workplace. One last word, and this is really, really important. So more than anything, for those workers who are coming in and continuing to provide service and doing their work, it is so important, as Kim was saying earlier, to communicate with them directly and often, and make sure that they get facts and that the facts are from a trusted source. There's a lot of myth and misconception and paranoia. The last thing we need is for our employees to be fearful of having to do the work that they do. But more importantly, they need to know that you're demonstrating leadership and that you're communicating, that you care about them, that you acknowledge what they're doing as being important, that you're able to address their issues as they come up, because every case is going to be different, and every week, every day is going to be different. So it's now more than ever, it's important for leadership to step up and demonstrate that you're there for the folks, and you're behind them, and you're going to get them what they need to be able to do their job safely and well. And one other thing is, this is interesting. I sit on the executive for progressive housing here, and one of our board members suggested that we write a letter to the staff, and I thought, well, gee, why didn't I think of that? I mean, it's so important for your board at this point in time to be not out there, but to be able to communicate to the staff how much they appreciate what they're doing. So if there's a way you can do that to get your board chair or any of your board to acknowledge and thank the staff for what they're doing, and as often as you can, I think people will feel appreciated and supported. So I've set a whole bunch of resources here. I think we may have put them on the side as we've gone along, but you are going to get copies of these slides, so you will have access to these links. Many of them, as I said, are updated on a daily basis. I've got the 3 HR Insider links in here, one of which is the link to their webinar. And there's the BC WorkSafe and the Canada and BC Assessment. One of the sites I've been following is Worldometer, which is basically showing the incidence of cases around the world. And I keep looking and hoping that the BC curve is kind of flattening as we go. So I think we're ready for some questions and answers, and I'm going to ask Kim and Shane to step up here too. There may be some questions for them.
Absolutely.
Thanks, you guys. So, questions? Did we get any questions? We had some from before. And I don't know if I wrote them down. Hey, do you have the questions that came in earlier?
Hi, Marsha.
Oh, yeah, I have one. Okay. I have one. Okay.
Go ahead, Marsha. I'm not, yeah, go ahead.
Okay. So here's one. If a staff person has any cold, flu, or virus symptoms, and you're making them stay away from work for 7 days after the last symptom is gone, does that make sense? I'll throw that over to Shane.
I mean, the regular or the guidelines is that if somebody's sick, they self-isolate for 14 days. Obviously we're still in cold season, we're still in flu season or regular flu season, so that's a really difficult call. I think even for healthcare workers, they've been getting colds, but once that cold is passed, they have been coming back. So I think that at this point, though, if they are sick, everything is assumed that it's COVID at this point. So yeah, that's a reasonable amount of time after their symptoms have gone. So 7 days after their symptoms, so 14 days though of isolation.
Okay. Second question was, if a staff person walks off the job because they can't cope with the tenants not practicing proper social distancing, can we discipline the worker? I'm going to take this one. So the appropriate approach would not be discipline in this case. The worker is basically refusing to do work because they consider what they're doing to be unsafe. And the safety issue is they can't keep distance, an appropriate distance from the people that they are, from their clients, from the residents, and that's putting them at risk. So you wouldn't discipline the worker for that, but what you would do is remove have that kind of work be done in a different way. But, and I should say before doing any of this, your residents need to also you need to communicate with your residents as much as you do with your staff. So you need to be able to tell them that they need to practice social distancing. They need to be cleaning their units. They need to be washing their hands, using hand sanitizer and all of those things. So, or just washing their hands basically. So if your tenants aren't aware, then you need to make them aware. That's a measure that you can take. And in terms of what you can do for the worker is determine what they can and can't do, and try not to impose the work on them. So try and find a way of them being able to achieve what they need to achieve without necessarily having to face those tenants. So that would be the approach I would take. First, educate the tenants. So work with the tenants, and if that doesn't work, then try and accommodate the workers so that they don't necessarily have to put themselves at risk in that way. So the third question we got is, what is adequate protective equipment for maintenance staff who have to make emergency repairs in a tenant's home? Shane?
So I can probably answer that one.
Mhm.
So, I mean, it really does depend. So the first thing that needs to be actually assessed is the priority level of whatever repairs that have to be done. Is it something that has to be done right away, or can it be deferred to another time? The second part is to consider, if they are coming into a home, you have to consider that that person may be infected, and or the actual work person that's going into the home could also be infected. So again, social distancing. The worker should be wearing a mask, just a regular surgical mask. Does not need to be an N95 mask if they are adhering to the social distancing. And obviously, again, hand washing, the social distancing, and then the cough and sneeze etiquette. It really is important, and it's really important to inform the resident that where they're doing the repairs and that of those things as well. So it's not necessary, unless you are in absolute close contact with a person, even if they're not infected, it's not necessary to wear an N95 mask, just a regular surgical paper mask, and then the hand washing as well.
Thanks, Shane. Do we have any other questions that came in?
Hi, Marsha. Yes, we do have several questions, and we've just had a small technical issue. So please just bear with us while we're just trying to pull up the question. Okay, thank you. Sorry, everyone. Thanks for your patience on this.
Maybe I'll just talk a bit. You know what, I realized I didn't talk a lot about working from home. And that's probably a very big part of this. So, I mean, to the extent to which you can keep your employees on a whole salary, on a full salary, working from home is a great option. But you should have a work from home policy, and you should have a work from home policy that's particular to a pandemic period. Otherwise, you may face a situation when everything's said and done, everybody's back to normal, where that employee says, well, I was able to work from home during the pandemic, why can't I do that now? So, and it may be that you decide to allow somebody to do that. So the pandemic may present all kinds of opportunities, interesting opportunities, but you don't want it to hamstring you for the way you operate when we're all back to normal again. So how you doing, Kate?
Hello, it's Marika here. Hi, everyone on the line. I'm the policy director here at BC Nonprofit Housing Association, and I have a question for you, which is, it's on the topic of working from home. So the question that came in is, do you consider that there's any difference between working at home and then working at home during this pandemic? Are there any kind of qualitative differences there, or quantitative? Is it more of a quantitative difference? Like, what kind of, is there a difference, I guess, is the question.
So there's a difference in that the employee shouldn't really be leaving the home to do business if they have to, right? So if they were in an office and we're doing business, attending a site or attending a business meeting, that would be fine if it weren't during the pandemic. During a pandemic, however, somebody's working at home, they're staying at home. The same rules apply in terms of WorkSafe BC, in terms of occupational health and safety to their workplace there. But the legal experts were saying they were thinking issues around ergonomics may be a little bit relaxed. Ordinarily, if you set somebody up to work from home and it's not during a pandemic, you would have to make sure that the ergonomics of their workstation were appropriate, right? So they were done properly. So you could do an assessment and make sure everything's set up properly. And that's to protect the worker, because if their workplace is actually their home and their home office, the same rules still apply. If they're injured or disabled in any way, then they're entitled to WorkSafe compensation. Does that answer the question? Or did I confuse you?
Oh, no, I think so. Yeah, no, that was from one of our attendees. So
Oh, okay, great. Good.
I'm just trying to navigate my question frame window here. Okay, here's another one. Just a comment says, oh dear. Property management services like custodial and janitorial workers. Can you clarify if this is airborne or not? So it's from one of our members who was asking about, you know, their janitorial and building management staff. It sounded like you are suggesting that this virus is both. So if we could just maybe just get some clarification around how this virus is transmitted again. I think there are lots of resources that are telling us this, but I think it's always good to keep on. Yeah.
Absolutely.
Thanks.
So again, this is primarily droplet. So it is, you know, when somebody coughs, they cough on a surface. There's droplets on that surface. The virus can live on those droplets. So it's not really, so it's confusing because it is airborne as well, only when there's a cough. So it aerosolizes when there's a sneeze or a cough, but then it lands on surfaces. So that's where the social distancing comes in. So if you look at how a cough transmits, it's about 3 feet distance that the droplets will fly with a cough or a sneeze. So that's why they've got the distance of 6 feet or 2 meters. So it does live on surfaces. So those droplets can fall and live on the surfaces. It's in the air immediately when the person coughs or sneezes. If you are walking along and somebody sneezed there 5 minutes ago, it's no longer aerosolized in the air. So if they are doing janitorial services and you know the staff have left for the day, there is nothing that is in the air. And that's just based on the latest information. So obviously things do change and do keep in, you know, up on what the latest information around that is. But at this point, the only time that there's a risk that it is in the air is when somebody coughs or sneezes.
Great, thanks, Shane. We have another question, and maybe this is also to everyone who's listening. But has there been any consideration around additional pay for employees on the front lines? So like along the lines of danger pay. Has anyone heard about that happening? Marsha, maybe you want to?
Yes, I've heard of that happening. So you cannot do it in a unionized environment because the collective agreement probably wouldn't provide for that. However, you could, if you had a good relationship with your local, you might be able to do you know, a local issues agreement or some kind of a memorandum of agreement if you have if for your unionized workers. So I would check with the union on that one. But I do know of non-union workplaces where they are paying what they might call hazard pay and paying a premium for people coming in and doing the work. And of course, you're going to do that if you have the budget to do it. So for everybody, it's dependent on budget. But you may have extra budget, you know, so people being away. Yeah, so the answer to that one is yes, you can.
Thanks, Marsha. Another one that we came in was, how does protecting workers relate to staff who live with vulnerable family members? So how can you protect your staff and protecting your staff, but how does that translate into also protecting, say they have a sick family member at home or someone with a compromised immune system living with them? How do we protect kind of everyone involved?
So I can probably talk about that. I'll give a little bit of background for myself. So I am actually immune compromised, and I'm going every day to the hospital to work. So we do have in place in our family, because I need to protect my family too, very, very strict rules in coming home, you know, even our shoes, washing hands, you know, and ensuring that, you know, I'm not transmitting anything from work. I do at work, I'm in place the social distancing, you know, hand washing, all of those, you know, the cough and sneeze etiquette, all of those things to ensure that we protect, you know, the ones we love. So I think it's important, unless they are getting sick, it's important to ensure that they are following all the recommendations in terms of reducing the mode of transmission. So hand washing, cough etiquette, and social distancing. Now at home, we're not necessarily social distancing, but social distancing when they're at work.
Thanks, Shane. And we have another question that kind of leads into that, which is just around guidance around when workers are to use PPE is unclear. So particularly, you know, since the bigger risk is workers bringing community acquired virus into the sites, and what capacity do employers have to ask staff to change their clothing when they come into the work site? And this is from a member who runs a mental health residential facility with frail elderly folks.
I mean, that's a really good question. So I guess it would depend on the capacity of the organization. So if they are able to put in place something where they have a uniform or something that people change into, then certainly as another measure that would be a reasonable thing. I think the other important part of that is, you know, the staff doing sort of the self-assessments on themselves to make sure they're well when they're coming to work. I think it has to be really pushed home, the idea around in terms of educating the staff that they need to recognize the symptoms in themselves, and if they're sick, they need to stay home.
Right. Okay. Thank you. Let's see. We also have some very specific questions. So is there a specific layoff code right now for ROEs that would identify the layoff as a temporary layoff? Marsha, do you know?
I'm sure there is. And you're not supposed to, that's one thing I should mention with the ROE, you're not supposed to put a reason. They're not looking for reasons right now. So you just basically, you don't have to provide notice. You just want to get the ROE to Service Canada as quickly as possible.
Great. Okay, that's good. That's
so.
Clear.
I'm sorry. There would be a code for layoff, but you don't have to put the reason. Okay?
Not right now during the pandemic.
No.
Right. This is an interesting question, I think. Oh yes.
Yeah. Could I go back to that question, because I
please,
captured the one part. So the other part is about the use of PPEs and the appropriate use of that. So again, it is around. So PPE, when we're talking about PPEs, we're talking about, you know, masks, could be gloves, could be gowns, could be also face shields. So it all depends on what kind of contact you would be coming in to with the clients that are there. So if you are in close physical contact, like you're providing a care, you need to have, you know, certainly, you know, you have to assume, first of all, that you might be a carrier and not being symptomatic, and or the person that you are caring for is maybe not symptomatic, but also maybe has the virus. So you need to be, wearing, a gown, gloves, mask, and a face shield. So that would be the minimum if you're in close contact with somebody. If somebody is proven to be COVID-19 positive, certainly, and are still in their home, convalescing in their home, and you need to have close contact with them, you would definitely need to be wearing an N95 mask. So that is the standard of care, is an N95 mask, goggles, or a face shield. And if you're not in close contact, just a regular surgical mask. Now, that would also be depending on what's available within those facilities. If they are providing close care to somebody, they need to be able to provide those equipment, pieces of equipment.
Yeah, and to just add to that, if they don't have the equipment, then those tasks can't be conducted, because then they're putting their staff at risk, and that's an HR piece Marsha might address also.
Great.
Okay, thanks.
Thank you. The next question is around what happens when an individual abandons their job and are not sick? That they, during this period of time, they've abandoned their job. What kind of processes, or what are the steps around that? Maybe Marsha, you could answer that question.
Yeah. So I'm assuming, or I don't, maybe I shouldn't assume. So if the employee just does not show up to work, does not contact the employer and give them a reason, and continues to be absent for a period of time, whatever I would say 3 days is probably going to be sufficient to consider that they've abandoned, then you would send them a letter. You would behave as you normally would, because they haven't given any indication that they have abandoned the position for fear of the risk of infection. So you have no reason, in other words, to justify, and they haven't given you one, why they're not showing up to the workplace. So don't make any assumptions. Send them a letter, registered letter that says, you will have been considered to abandon your job unless we hear from you within a period of time. And if you hear from them and that's their reason, fine. Then you deal with it on a one-on-one basis. Maybe arrange for some a temporary layoff or some kind of leave for them, so that they are able to get their job back at the end of the day. But if you just don't hear from them, then and they've just abandoned the job, then that's fine. Then ultimately you're going to terminate them for frustration of contract. But again, if you have that situation, I would consult a lawyer and just make sure that that particular case should be handled in that way. Okay.
Thanks, Marsha. I think we have time for 1 or 2 more questions. And I just want to make note that there have been quite a few requests for sample policies. Mm-hmm. So just to let the folks who are still on the call know, BC-MPHA is working as fast as humanly possible to pull together some sample policies to post on our website in our COVID-19 response page, to provide some templates for our members, and actually anyone who accesses the page. Maybe Marsha, you and I can work on a couple of those pieces, and we'll send an email to everyone on our mailing list and let folks know as we post these policy templates.
I think the other thing is HR Insider and OHS Insider has those policies, because that's where I got the list from. And they give you trial access for up to 2 weeks. And I don't think that they would mind if you, in fact, could be really, really generous because of what's going on. And want to make sure people have the information they need to be able to, meet the needs right now. So,
wonderful.
Yeah, we'll work on it as well. But I'll probably just borrow from them anyway. So
wonderful. Okay, thank you. And then one last question, which I think is also an important one. The majority of our members are nonprofit housing societies who have boards. And this question is around engaging boards. So do you have tips for engaging boards? Currently, my board has been primarily concerned about operational issues like HR concerns and has not been engaged in strategic planning, like putting an emergency contingency plan in place. How can I ensure the board engages in contingency planning?
I don't know, Kim, would you say that contingency planning to me is more of an operational thing, but the board could have a strategic objective that says that the organization shall have a pandemic plan? What do you think?
So, I mean, you know, I think it's always good to have a business continuity plan, and usually the pandemic plan is part of that. You know, and I think as well, we're kind of learning a lot of things here as we go along. Some organizations have nothing and are really using their, I guess, common sense, and there's nothing wrong with that. But the challenge with not having these business continuity plans is that you know, that when you come across something, you've nothing to refer to. So I think the board, if you know, if a board is part of the organization, I think that the board could probably initiate and ensure that those types of things are happening. Throwing it all to the board, of course.
Yeah, I mean, the board has a duty to govern the organization and ensure that it is able to continue.
Exactly.
So to me, that's a strategic objective, that there be a service continuity plan in place, pandemic plan, whatever you want to call it.
Yeah.
Yeah,
no, I think, you know, and in this case, if there isn't one, the least that they should be looking at is having a pandemic plan. But moving forward, then a business continuity. I mean, the contingency planning is what we're doing in the moment type of thing. You know, it's referring to that plan and what is the contingencies around that plan in the event of. So I think, yeah, I think the board, should there be a board, it's really crucial that they're part of ensuring that there is something.
Okay, any more? Are there? I should mention, let me see, was this going to be frozen again? Please no. So at the Wisdom Group, we've got a number of people that from different backgrounds, and what we do is we basically provide support and solutions to nonprofits that don't have in-house services like HR and IT and communications and occupational health and safety and all of those majorly important functions. So Kim is actually one of our consultants, and we all kind of work together. And Kim and Shane have done a recent pandemic plan for an organization and are available to help out if you need that kind of thing. And it may be something that you want to have later or sooner, I don't know. But we're always available to help nonprofits, and we have a community page where the idea is for nonprofits to be able to come in and speak to one another, and it's a Facebook page, so you're just sharing information, sharing ideas and experiences so that you can learn from one another. And I know that BC Nonprofit Housing Association also has a forum. Maybe you want to talk about that, Marika or Kate?
Yes, yeah, sorry, hi, it's Marika here. I was muted. Yeah, so we have a forum on our website, and you can access that through our, you can go to our main website, and there'll be instructions there to direct you to the forum. And we're really encouraging our members to go there, post questions that BC MPHA staff might be able to answer from all of our departments. And also we're really encouraging members to engage each other and kind of set up a very informal kind of community of practice and knowledge sharing through that forum. So we can all learn together through this, this crisis. And so I really encourage you all to go there and check it out and share any resources you might have. And BC NPHA staff are also using that to help inform how we're helping to support our members too. So coming up with policy templates or other types of resources.
I was just going to suggest,
yeah. So yeah, it's valuable for all of us. So I encourage you all to go and check it out. Thanks.
It's great. I think one of the things about this whole experience is the sense of community that people have, and you know, as a couple of things that I was involved in were shutting down, you know, my comment was, well, I really don't feel like I'm missing anything because we're all in the same boat. And we will come out of it together, hopefully sooner than later. But there'll be a great deal of learning in the process. So I really highly recommend journaling your experiences and continuing to talk to one another, helping one another, collaborating. And if you have any questions, you can always contact me at phone number 778-847-1940 or through our website. But I want to thank BC Nonprofit for giving us the opportunity to speak with you today, and I hope this was helpful. If you have any more questions, just leave them with them, and we will get back to you and try and answer them for you after we're finished here. Thanks.
That's great, Marsha. Thanks so much. I just want to say on behalf of BC Nonprofit, thank you very much for the presenters for offering your time to facilitate this webinar, as well as the attendees for your questions. And again, just as a reminder, all registrants will get an email with a link to the webinar recording within a day or so. For more information on COVID-19 related topics for housing providers, please visit bcmpha.ca, the resources section, and or the wisdom group as well, as Marsha has alluded to. So thank you everyone very much, and yeah, we'll have the resources available for you soon. Bye for now.
Thank you.
Thank you.
Thanks, everyone. Goodbye.